Hello, everybody. Thank you so much for joining us today. My name is Acl Castro, he, him, and I am so glad to welcome you here. So I'm just going to go over a quick startup presentation as everybody is coming in. As I said before, my name is Acl Castro, he, him, and I am the Chief of Diversity here at Free Health Shadowing. Free Health Shadowing is a student-led, minority-led, and woman-led nonprofit organization dedicated to helping prospective healthcare professionals gain access to educational resources, no matter what their demographic status, their ability, or location in the world. So just a quick PSA, we do have closed captions for all of our sessions to accommodate students of all needs and abilities. If you have ideas about how we can have more initiatives like this to be more accessible to everybody, please email us for more ideas at info@freehealthshadowing.com. Since this is an international program, we would love for you to drop in the chat where you are Zooming from today. Awesome, we've got people from all over. It's always great to hear more about you guys. Okay, so if you want to stay in the loop with pre-health shadowing, make sure you go on our website and sign up for our email list. And that way you can get all the latest updates every week on what sessions are going to be going on and what other events we may be hosting. We promise we don't spam. We only send one email a week with updates. And you can also go on our website and link your Google Calendar to ours so you can see what time sessions will be in your time zone. That is always very helpful. You can also follow us on Instagram and TikTok, and because we are active on both. Since pre-health shadowing is a student-led platform, we also try to get you guys, and as students ourselves, different resources that you can use. So here, I'm just going to go over some quick opportunities for you guys. So first, we've partnered with Kaplan to get you guys a 10% discount code that we can use on all Kaplan products, as well as some free resources, such as study guides for the GRE, the MCAT, the NCLEX, the PCAT, and other standardized tests. So please make sure that you follow the link in the chat and take our demographic survey to sign up and be able to get all of these resources. We would also like to draw your attention to another amazing program, which is Neolith. Neolith is an online mental health platform for students. We all know that college and young adulthood is stressful enough as it is in non-pandemic times, especially for pre-health students. So that's why we partnered with Neolith to get you guys free resources and access to those services. If you utilize the link in the chat, you can use the code pre-health when signing up. You will get these services for free. So another organization and cause we'd like to draw your attention to is Mask for Mask. Mask for Mask is a woman-led organization that donates 4 masks for every 4 masks sold during the COVID-19 pandemic. This is a really great cause. These masks will go to people in the homeless community, healthcare workers without proper PPE, and those who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order when you buy through this method, and also 10% of the proceeds will go towards PHS. So you're supporting 2 great causes. This is definitely helpful to us because we are a nonprofit that runs solely off of the support and hard work of our students. If you want to play a bigger part in supporting pre-health shadowing, we invite you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects, such as professional outreach, grant writing, and more. Of course, we understand that everybody here is probably a pre-health student and doesn't have a ton of time on their hands. So we also offer the opportunity to volunteer and do some asynchronous tasks that may involve social media design, other professional outreach opportunities, and things like that. In this way, you can also get accredited shadowing or accredited volunteer hours through us. So if you want to become a part and support our organization, I encourage you to follow the links in the chat or go on our website. If you are a high school student, we've got you too. You can use the same link and sign up to volunteer for us and indicate that you're interested in HTP. What is HTP? HTP is our high school training for pre-health shadowing. It allows students to connect and network with other prospective medical professionals at a high school level, and also get in touch with colleges and programs that they might be looking to in the future to help enhance their applications. So we encourage you to join us in this capacity if you are in high school and looking to further your knowledge and get involved. We are also looking to support our student community in any way that we can. So if you are looking to get published, we encourage you to submit articles, reflections, reviews, and success stories to our website at www.prehealthshadowing.com/blog submissions. This is a great opportunity to get your work featured and something that you can definitely go ahead and put on your CVs, your resumes, your applications, anything really, just to have your hard work recognized. So a part of our mission at Pre-Health Shadowing is to promote diversity. In order to do this, we have launched an initiative to have monthly diversity panels that are dedicated to celebrating different demographics in the field of medicine. Some of these upcoming events include an all-female panel for Women's History Month, which will be happening on March 27th and 28th. So make sure to mark your calendars for those days. We are also looking to host similar events such as a COVID-19 roundtable, an international student forum, and also a panel on LGBTQ+ health disparities. So if you know mentors or professionals that have, or even professors that have inspired you and you think could contribute to these conversations, make sure to nominate them today by using the link in the chat. So as I mentioned before, we are a nonprofit that runs solely off of students and the hard work that we put into this organization to keep it up and running. So if you can, we humbly ask that you donate to our program. It can be $1 or $2. It doesn't have to be much, but we figure if everybody pitches in here and there, we can keep our website running and our Zoom going. So if you guys can, that would be great. Of course, we completely understand that this is not something everybody is capable of doing right at the moment. And so we simply ask that you just share and spread the news about our program and perhaps share this link with people you think might be able to donate in order to give this opportunity, in order to keep these opportunities free for everybody. So throughout the session today, please make sure to type your questions in the chat and our co-hosts will make sure to ask them during the second half of the session during the Q&A. Make sure you also are taking good notes because our post-shadowing assessment will be available to take to earn a certificate for your virtual shadowing today and verify your hours. I will go over more information on how to do that at the end of our presentation today, so make sure to stay tuned for that. Last but not least, if you can, please turn your cameras on. It does make it feel a little more personal. Of course, we understand that everybody has a different situation. Your Wi-Fi might not be great or whatever. So no pressure and it's not an obligation. But if you want to be, just to make this a little more personal, do turn your camera on if possible. So thank you everybody for listening to my little spiel today. And we have our professional here today and I would love to introduce him and he can go ahead and get started with our presentation.
All right, hi everyone. My name is Anthony Gauthier. It's so amazing to be here today. Thank you so much for having me. I'm really honored to be able to talk to you all and see how exciting this, this organization is and keeps growing and growing, and really fortunate to be a part of it and help it grow. And I look forward to hearing from all you out there after this talk. You could feel free to reach out to me and I'll give you some ways to connect to me. Let me just get my PowerPoint up here, and maybe in the chat, for any of those that are interested in becoming a PA, drop it in the chat, or just anything you're interested in your career path. Are you doing MD, NP? I like to see where everyone's coming from. It'd be really exciting just to get an idea of how diverse this group is. So my name is Anthony Gauthier. I'm a practicing physician assistant, and I'm also a certified athletic trainer. And so I'm going to share with you my journey to how I got into working in sports medicine. So I became a physician assistant in 2008, and I've been working in sports medicine ever since. So since 2008, I've been working in the field of sports medicine, and I'm really excited to share my journey, tell you a little bit of how I got to where I am today, some of the fun things I get to do, the highlights, some of the interesting things that working in sports medicine really brings to the table. And then also go over a handful of cases of some of kind of the more interesting things, common things I see in sports medicine. So we'll be able to learn as we go. For all those that are interested in the PA profession, sports medicine, or just healthcare in general, I hope that you all find something that you can get out of this talk. And again, I'm really excited to be here. So let me just start with my timeline, because everyone, you are all in different paths on your journey, and each and every one of you are thinking like maybe it just feels so far off into the distance, your ability to achieve your goal. Maybe your dream is to become a PA, a MD, nurse practitioner, researcher, and you just in undergrad, or maybe you're taking a gap year and you just think, my goal is just so far away. It's just so far out there. It seems unattainable. But you know what? Just keep working at it every single day. And the baby steps and those small increments are going to add up. And next thing you know, you're going to look back and reflect and have achieved your goal and be in a similar situation like me, where you look back and school feels like it was so long ago. So trust me, I was in the very same position you were one time, where I'm just thinking, I'm never going to reach my goal. It's just so far away. There's so many steps. There's so many obstacles. How am I actually going to achieve this goal? But you just keep working towards it. And next thing you know, you've achieved it, and you can reflect back and you could give back and help others achieve their goal, just like I have the opportunity today. So my timeline, I went to Cal State Long Beach out here in Southern California. I graduated in 2005, and I majored in kinesiology with the emphasis of athletic training. Now that kind of set the foundation for my interest in sports medicine. Growing up, I played sports all my life. I had a couple of injuries, nothing like super major, nothing where I required surgery, but I had a handful of injuries, and that kind of sparked my interest in sports medicine. I became really excited to learning how the body can like heal itself after injury, what things can be done to help improve fitness, health, longevity. And so that was all sparked early on in like high school and then going into college. So when I was in undergrad, I wasn't exactly sure what I wanted to do. I knew I wanted to do sports medicine, something related to that aspect. And actually, initially, I became kinesiology major in the emphasis of athletic training. But really, I wanted to become a physical therapist. My goal was to get into physical therapy because I had a couple injuries and I would go to physical therapy back then. And I was really amazed at how someone could take the time to rehab you, show you different stretches, exercises, use modalities, different things to help get you better so you could get back to perform at the top level you were prior to your injury. And that really like amazed me. And so initially I was on the route of physical therapy. So one thing I recommend that you all do is whatever you're interested in, you should try to get some kind of entry-level position where you could work either alongside that position or that career path, or kind of be entry level in that career path. So I started working as a physical therapy aide, and I was working at this physical therapy clinic, and it really opened my eyes to the profession. And I learned a lot about hands-on physical medicine, the modalities, all the different things that go into physical therapy. And as much as I learned and enjoyed it, there was just always this kind of these questions in the back of my mind when I were helping the patients. I'd think like, well, maybe their motion for their knee isn't so great because of something, is it them not rehabbing enough? Is it some other aspect? Is it just their tissue and they build scar tissue more than others? Or maybe there was something related to the surgery. All these questions would just keep flooding my mind whenever I encountered a patient that maybe wasn't having as great an outcome as we'd hope. And so I started realizing, you know what, as much as I liked working in the physical therapy realm, I felt like I wanted to be more involved and hands-on in like the diagnosis of the conditions, learning more about surgery during the situations like a total knee replacement or ACL reconstruction. And so I found myself learning and becoming more and more interested in that side of medicine. Physical therapy is an awesome profession, but I felt myself not as connected as I thought once I started working there. So it's really important for you guys to start working in a field that you're interested in, shadow, get some experience, because you might be in a similar position like myself where you realize, hey, it's not actually all that I thought it was going to be or all that I thought I wanted it to be. And so take the time to do that. It was during this time, it was kind of the end of undergrad, as well as I took a gap year, that I realized, okay, I'm going to become a PA. And how did that happen? It was because I had a family friend that was a PA, and she knew like I was interested in medicine and kind of on the fence of should I go to PT school or not. So I shadowed her, networked, connected, learned about the PA profession, then connected with more PAs, asked a ton of questions. Just keep asking people as many questions as possible. That's how you're going to gain a better understanding of the different career paths. And so once I kind of learned about PA profession, researched it, shadowed, I really drew this close connection to it. And I felt that's more in line with what I see myself doing long-term career-wise. Because if you think about it, you're working towards this career and you're working hard. It's a lot of time, effort, energy, financial initiative for achieving this goal. And you don't want to put all that energy into it to realize, working a handful of years in that, this isn't for me. I want to switch to something different. So it's better to figure that out ahead of time before you really put all that energy in. So what are some of the things I wish I knew when I was in undergrad? So these are some of the key things I want to share with you, because I think looking back and reflecting, these are things that can really help you and guide you as you're going down the journey for your career path. So start working in the medical field early. This is particularly for those that I help get into PA school. I notice you work hard in undergrad, and then your senior year, junior summer, senior year, that's when you start working to get the years of experience. And that's not enough time for you to figure it all out, or enough time to really accumulate the hours needed to apply to PA school. So start working in some aspect early on, freshman year, sophomore year. I know you still want to be focused on your studies and doing well academically, but try to get a part-time job, MA, physical therapy aide, phlebotomist, EMT. Those certifications and licensures are fairly easy to get. And they could open up some doors to get you the experience that you need. And that experience is going to just lay the foundation, because you could build off of that. Just imagine if you started working part-time, a handful of hours your freshman year, and you took gaps for summer and spring break and things like that, you would accumulate more hours by the end of your senior year than someone that just decided to work full-time the summer of their junior year and maybe full-time once they graduated from undergrad. You have to think of it in that aspect. Part-time for the course of 4 or 5 years is going to really add up to a substantial amount of work experience, which is really going to help you out no matter what field of medicine you're applying to. Because all of you are going to be in similar situations when you're applying, and you have to think, okay, this applicant has 4 years of experience and this applicant has 1 summer. Maybe their experience and the type of field they're working in is different, and one might be weighed more than the other. But when it really comes down to getting accepted into these programs, they want to see what kind of experience you have, the longevity. You can learn so much over the years. Also, for those involved in things like this, start volunteering. Just volunteer in anything you're passionate about. It does not have to be medical related. Of course, that could help. But I know people that are just so dedicated to helping, the homeless, at their church, different other non-medical related things. And they do so well because they're passionate about it. Remember, if you're just in a club and you're just going through the motions because you think it looks good on your resume or transcript when you're applying, whatever, everyone's going to be in a million clubs and being, on the board and things like that. But if you can show longevity, again, like if you're in the same club every year and worked your way up and was maybe the president of the club your senior year, or maybe you volunteered in your church all through high school, all through undergrad, and you became like a leadership role or position, that's going to help you out so much more. Most of these healthcare programs that you're applying to, they want to see leadership roles, and there's no better way to gain that than by putting in the time to volunteer. The next thing is don't be afraid to network and ask for assistance. So many people, myself included, believe me guys, I was the biggest introvert, never wanted to, I was the person that sat in the back of the class, never raised my hand, never asked a question, never went to the office hours, never talked to anybody. That was just me. I know it probably seems different now because I'm able to talk to you guys. I give talks and things like that. But back in undergrad, I pretty much did my thing and that was it. And so don't be afraid to network and ask questions. You're going to come across people in the field, come across the people that have reached the goal that you want to achieve, and ask them questions. And everyone's busy and they might not be able to help you right away. But if you kind of build a connection early, it could really grow into mentorship, writing you a letter of recommendation. You don't know what it could lead into by just taking that initial step and asking questions. And just ask questions about how do they like the profession they're in? What are some of the pros and cons? What are some of the things they'd have done differently when they were in undergrad? Questions like that, open-ended questions, really lead to gaining a lot of wonderful insight that can help you around on your journey. So basically, I completed undergrad, had my gap year. I applied to 5 PA schools, got waitlist, had 3 interviews, got waitlisted on 2, but got accepted into Western University of Health Sciences, which was actually my top choice because it was in Southern California. I grew up about 20 minutes away from the program, and I knew I could really save a ton of money by moving back in at home and attending their program. And I loved it there. If anyone's interested in Western University, it's in Pomona, California. They have a DO program, dentistry, podiatry, NP. They have pretty much every major healthcare profession there, and really proud of the PA program there. And they laid down, like I said, they laid the foundation for me to be successful. So if anyone's interested in that program, feel free to reach out to me. I'd be happy to answer any questions that you ask me. But some of the things people don't think about or maybe wonder about for PA school, yes, PA school is difficult and it will make you doubt your existence at times. There are going to be times where you're just so overwhelmed with the immense amount of material that you have to consume and absorb that you're going to think, I can't do this. This isn't for me. I made the wrong choice. I don't have what it takes. But guess what? Every single person is there for a reason, and every person is there because they deserve to be there. So don't let the imposter syndrome, don't let the self-doubt weigh you down. Just keep working hard and you'll be able to persevere and succeed. And yes, you'll have to make sacrifices between school and life around you. So I attended Western between 2006 and 2008. There is that like 2.5 year time span where I missed out on important events. And granted, you have to make these sacrifices because you have a goal that you want to achieve, and there's going to have to be sacrifices for you to achieve that goal. And it's not a bad thing. You're going to have time for some school life balance, but you definitely have to pick and choose. Am I going to go out and hang out with friends and party it up on a Thursday night or a Friday night? Or am I going to stay focused and study because I have this big exam or I have this clinical exam coming up? So you're going to have to really sit down, think about it, and figure out and weigh what things are important to you, because being successful in your career should be very important to you. In terms of working in the healthcare field, you have to think other people's livelihoods, other people's lives, other people's illnesses in your future patients are going to be weighing on you. So you want to work hard during PA school or during your program so that way you can be successful and do well. You want to be competent. You want to be able to provide compassionate care and help those in need and not have to be referring back and not knowing what you need to know because you're too busy hanging out and partying during your program. It's not going to happen. Plus, you're not going to be successful. So understand you're going to have to make sacrifices. When I meet up with friends nowadays, they'll say, remember when we went and did this, or remember when this happened? And I'll think back and I was like, when did that happen? And they'll be like, oh, around like 2007. And I was like, yeah, that was PA school. There's like that kind of blur of time where I just remember I was in PA school and I don't remember much of anything else. And that's just some of the things that are going to happen when you have to sacrifice to achieve and reach your goal. But just remember, if you keep working hard, you're going to be able to, and it'll all work out in the end, because now you could be able to have the privilege to help people get better, help people achieve their dreams. And that's what it's really all about in the long run. So I completed PA school in 2008, and part of my externship for Western was working at an orthopedic clinic in Long Beach, California. My goal was to be able to move back to Long Beach. I had gone there from undergrad. I love the city. And I thought, you know what, I'll do my externship. I want to do orthopedics. I want to be in Long Beach. So what did I do during that externship? I just worked my tail off. Always there early, asking questions, networking with all the different surgeons, learning, trying to retain and gain as much information as possible. I would volunteer to stay late, volunteer to help out on the weekends. Whenever there was an opportunity I felt I could learn, I was there to take advantage. What ended up happening is on my last week of my clinical externship with them, the head of the group said, "Hey, when's your last day here, Anthony?" And I said, "You know, actually it's Friday." This was Monday. And he asked me, and he's like, "When's your last day?" I said, "Actually, this Friday is my last day." And he said, "Okay, I want you to come in tomorrow morning early wearing a suit and bring a resume." And I'm thinking, all right, I'll do it. See what happens. I kind of was like, okay, cool. So the next day I show up, I'm wearing a suit, I have a resume, and the two head orthopedic surgeons of the group, they sit me down in their office and they say, "Anthony, do you like it here?" And I said, "Yeah, this is an amazing group. I'm learning so much. Thank you so much for this opportunity." And they said, "Could you see yourself working here in the future?" And I just kind of like fell back in my chair and was like, definitely, yes, I want to work here in the future. And they offered me a position. And that was just one of those things that made me realize I put in the hard work, the effort, I did everything I could, and it paid off. So I was offered a position to work orthopedic sports medicine right when I graduated from PA school. Most of you will find out when you apply to PA school or whatever field you're working in, actually, for in terms of MD, NP, PA, doing your clinical rotations is when you're going to network and find job opportunities. And it's very common, especially in PA profession, that you get a job either from a clinical rotation site that you rounded that and worked at, or networking through either different clinicians or different rotation sites. So that is why it's so important for you when you're on your clinical rotations to do your best, be professional, always crave learning, always go the extra mile, because you never know, it could turn into you being offered a job there. So in 2008, I was offered a position to work as orthopedic sports medicine during the COVID era. So one of the things is I was kind of the youngest clinician in the group. So I felt myself personally that I had more safety in being able to round on patients and see patients in clinic. So I kind of took it upon myself to volunteer and see patients in the clinic, to let those that are older or maybe had weaker immune systems or some other issues that put them at a higher risk, so they could stay home at that time. Because back then we weren't 100% sure how things were going to pan out, how serious the COVID was at that time. In the center photo, that's me suturing for a total knee replacement. We wear a hood, so that's that big helmet thing on. And that's really one of the fun aspects of my day as a PA, is being able to assist in surgery. And so I get to assist on numerous types of surgery, ranging from shoulders, procedures for the shoulder, the knee. Here we do knee replacements, hip replacements. And so there's just a lot of different surgeries that I'm able to assist on. And a question I get a lot of times from people that are interested in becoming PAs that want to work in surgery is, hey, when I first graduate, will I be able to get to do all these different things that you're doing in surgery? And the answer is probably not, because you have to think that surgeon wants to build trust before they're going to let you do more and more. So once you show that you have the skills and you've been there and you could build the trust with whoever your supervising physician is, or the surgeon you're working with, or whoever you're working with, once you build that trust in that relationship, they're going to let you do more and more. And so those are some of the highlights of being, been practicing as a PA for as long as I have, is I've built that trust, that reputation, and that experience that I'm able to do more and more. And on the far right-hand side, this is me assisting with the athlete off the field. And one of the things we also do is we take care of the local high school, the local junior college. And there was a time where I took care of Long Beach State as well, helping cover games. And so, it's fun being able to hang out on the sidelines of the football field, because my undergrad was athletic training, which was pretty much you're hanging out on the side of the field and being the first responder, running out on the field during injuries. And it's neat because as a PA, my scope of practice has expanded. So there are things that I could be more involved with and help out more with on-field management of injuries and treatment, things like that, reducing dislocations, being able to irrigate wounds and determine if people need to get transferred to the ER or if things can be taken care of in the training room, or seeing an athlete get injured on like a Friday or Saturday and then following up in clinic on Monday and seeing if they need surgery or physical therapy, or just kind of developing that treatment plan for them, is something that's really exciting for me to be able to do. Like I said before, I've had experiences where I'm hanging out on the football field on a Friday or a Saturday covering, and an athlete goes down and gets injured, and I assess them, diagnose them, they follow up in a clinic, get an MRI, it's determined they need surgery. I'm there assisting on the surgery. I follow them during their post-operative course, like wound checks, making sure they're following their rehab. And then the next season, they're back out there on the field and I'm on the sideline watching them perform at their best. So that's something that's very satisfying and gratifying, to be able to have that connection with the patients, and follow them through from the moment they were injured to the moment they get back to play, is just really exciting. And as you get to work in the medical field yourself, you'll realize just how rewarding it is to be able to see someone and be able to help them in their time of need, rehabilitate them, help them get better, and then see them get back to their lifestyle prior to like the injury or the issue. And so that's one of the exciting things. Now let's move on to some cases. I have a couple of cases I wanted to share, and we'll go through some things briefly just so you guys can learn. And so the case number one, 18-year-old right-hand dominant male presents to clinic 2-day status post-fall while snowboarding. This is something that's been very prevalent in our clinic right now, as it's still ski and snowboard season, even though here in Southern California, there's some snow in the local mountains, but we get a lot of people that are going up to Tahoe and Mammoth for the weekends, and then they get injured up there and then come back home down to Long Beach, where we take care of them for their further treatment. So patient states he went off a jump and landed onto his right shoulder. He felt a snap. He was unable to lift his arm up, and he was taken down the mountain via ski patrol. So we kind of should get some ideas of what could possibly be happening after this injury. And they deny injury to other body parts at the time of the fall. Whenever someone has a bad fall, this is just kind of clinical pearl I want to share with you. When someone has a bad fall, bicycle, motorcycle, snowboarding, skiing, things like that, you always want to make sure that you check and assess for injuries to other body parts, because sometimes the initial area that's the most painful is just taking all the precedent at that time. But there are other areas that could have been injured that might not be as painful, so the patient's just kind of blowing it off, or the patient might not think it's serious and it could be something just as serious as well. Another thing I really want you to look out for is just concussions. I guess it's the athletic trainer in me, but a lot of people that fall off like skateboards, bicycles, falls from snowboarding, they might injure their wrist, their shoulder, and also strike their head, and they weren't wearing a helmet. And you ask them, like, are you having headaches? Do you remember having any loss of consciousness at the time of injury? And so those are important things to note, because you might get a high school kid that hurt their shoulder, also hit their head, and they're like, I kind of like blacked out. I don't remember what happened right after. And you say, well, have you seen anyone to get checked out for concussion or this or that? And they're like, no, my shoulder is just bothering the most, so I'm not worrying about that. Are you still getting headaches? Are you having sensitivity to light and loud noises? Oh yeah, I get headaches all the time now. It's hard for me to focus. And then you have to think in the back of your head, maybe they have a concussion as well in addition to the shoulder injury. Keep those things in mind. We have to take care of the patient as a whole. I know once we get into our specialties, we seem to kind of micromanage and laser in and focus on one particular thing, but it's important to kind of just assess the patient as a whole to have a better understanding and make sure you're not missing out on anything. So they present to your clinic in a shoulder immobilizer. Usually what happens is, we'll say Mammoth is pretty common. They'll go to the urgent care of the hospital in Mammoth. They'll get an x-ray. They'll find out that they have a clavicle fracture, get placed in a shoulder immobilizer, and the physician or clinician up there will say, hey, follow up with orthopedics back home, and they'll take care of you from here. And so when you see the patient, they have the shoulder immobilizer, and you see an observable deformity of their clavicle, kind of like this picture that I took off of the internet. It's not our actual patient. And so you could see that step off that's circled in the red oval there. And so that's pretty spot on. The patient said they landed on their shoulder, they heard a snap, they can't raise their arm, and there's an observable deformity at the clavicle. So you know that this is a clavicle fracture pretty much just by gaining the history, which is another important thing for you to consider, is always obtain a good history, because most of the time you're going to be able to figure out the diagnosis just from the history without really needing to look at the x-rays or the MRI scan right off the bat. So obtain a good history. It helps you diagnose. Most of the time you can pin down the diagnosis before you even look at any diagnostic tests. And of course, they're going to note pain with palpation over the clavicle and limited range of motion. And this x-ray here shows a displaced, means it's separated, mid-shaft clavicle fracture. So why is the clavicle one of the most common bones that's fractured? And if you have to go back to your anatomy and think of the clavicle and how it has a curve to it, now that curve, as it comes around, that becomes a weak point, especially with kind of an axial load. So if someone lands on their side of their shoulder and that bone kind of compresses down like that, right at that curve is a weak spot, and it's going to fracture. Now, interestingly enough, a lot of clavicle fractures look really bad on x-ray, but tend to do well and heal well on their own conservatively without needing any type of surgery. But some things to consider are how much displacement there is of the fracture. So in this x-ray, that's a significant amount of displacement. Also, you want to check the skin to make sure there's no tenting where the skin is poking up. And sometimes you can even have the bone kind of make a little poke hole through the skin. And those are things that are going to make you think surgical intervention is the right treatment. Also, when you're doing your physical exam, you want to make sure that you check the upper extremity and make sure it's neurovascularly intact. Basically, you have the subclavian, you have major arteries and nerve bundles running from your neck to your shoulder. And so those could be impeded on or injured from the time of the fall. So you want to make sure there's no numbness or tingling and no loss of motor function in their wrist or hand when assessing. Now, for this particular patient, they required surgical intervention. And for those of you that are interested in surgery, especially if you get into orthopedics, something you're going to find, the term you're going to hear often is open reduction internal fixation, or ORIF, O-R-I-F. And so whenever there's a fracture and there's more displacement than we'd like to see, then it typically requires ORIF for that. Open reduction, which means they make an incision for surgery and kind of line everything back up, and the internal fixation is either screws, rods, whatever they're using to hold the fracture in place. Now, having the plate and screws in that clavicle, the plate and screw is not what makes it heal. The fact that the fracture gap is now closed and the bone fragments are touching, or at least within the ballpark of each other, that's what's going to allow the fracture to heal. So just because someone has a surgery doesn't mean next week they could go snowboarding or play football. We still have to allow time for the fracture to heal. It could take 6 to 8 weeks just for the fracture to heal. And it could take a few months, like 3 to 6 months, before we let them get back to contact sports. So football, rugby, snowboarding, where you're at risk of falling on it again. So those are some things to consider with this type of clavicle fracture. But like I said, this in this time of year where people are going skiing and snowboarding, clavicle fracture is pretty common right now. Moving on to the second case, an elite level 23-year-old female soccer player injures her right knee when tripped during a soccer match. So she was basically tripped by the opponent. She felt a pop at the time of injury and noted immediate pain and swelling to the knee. So basically she was kind of tripped, her knee twisted, she felt a pop. For those of you that have played soccer, are involved in soccer, know about female soccer players, is pretty much this pandemic in ACL tears within female soccer players. And there's a handful of theories to why that is the case. I'm not going to go into the details of that for this talk, but so the patient is an elite level soccer player. She's fearful that she tore her ACL and her career is over. Pretty much most elite level soccer players, whether they're in high school, college, or pro, they're going to probably know of someone that's had their ACL torn and underwent surgery for their ACL. It's just that common in the female population, especially with twisting sports, basketball, soccer, volleyball, things like that. So on the physical exam for this patient, you're going to see a localized joint effusion. That means that the knee is swollen, the knee joint's like a water balloon. And so when it's injured and you have swelling, it expands and it all kind of stays localized in that area. Tenderness with palpation throughout the knee. So they're going to be sore all around the knee, the top, the sides, because they have so much swelling as well. Limited motion because of the swelling and also the pain inhibiting their motion, and laxity with ACL testing. So there's a handful of tests, special tests that can be done to help assess the ACL. Now the ACL stands for anterior cruciate ligament, and it's the main ligament in the center part of your knee. There's actually two of them. An ACL is anterior cruciate, and then the PCL, which is a posterior cruciate. Now ACL tears are more prevalent and common. The ACL prevents, so this is your femur and this is your tibia. The ACL prevents too much forward translation of the tibia. So the tibia going forward, the PCL prevents posterior translation. So usually there's some kind of twist, and that twist is what tears the ACL. In this picture here, it's an MRI scan looking from the lateral view or laterally. And in the red circle, the black band, there's this black band kind of going in a diagonal, and that's representative of a normal ACL. So on an MRI scan, especially in this image, a dark structure is going to be more solid and thick, and it's going to be representative of the ligament. And then on the other image that's showing a red circle, but you don't see the dark black, you kind of just see a fanned out gray, and that's representative of a torn ACL. Now, reading MRIs takes some practice and time. It's basically reading various shades of gray, and depending on what sequence you're looking at on an MRI scan, usually like fluid shows up white on certain sequences, and thicker, denser material will show up black. The bone is usually kind of a uniform gray color. So it takes a lot of practice and repetition of looking at the MRI scans. A lot of times, if you look at an MRI for the very first encounter, looking at it, you're going to just see kind of this like blob of gray stuff. But once you get an idea of the anatomy and the structures, it becomes second nature to scroll through an MRI scan pretty quickly and see what's wrong or what's damaged. And so one thing with the ACL is a lot of times the x-rays are going to be negative, and it's the MRI that's going to demonstrate the tear. So the x-rays are going to show the bone, but the soft tissue is not going to show up, especially like the menisci or the ligaments. But the MRI is going to be more sensitive and show those structures better. Not all ACL tears require surgery. A lot of it goes down to the patient's age, activity level, hobbies, their future goals. So in someone that's an athlete, especially in soccer, running, pivoting, twisting, they're elite athlete with their main goal to return to soccer, then the treatment plan would be ACL reconstruction. Now, some people kind of get confused in the terminology of ACL repair versus reconstruction. So the vast majority of ACL tears, the ACL does not have a great blood supply. So we basically trim the old damaged ACL out and make a new ACL with what we call a graft and put that in its place. That's an ACL reconstruction. sometimes, not as commonly, you can repair the ACL if it's torn in one section and it's kind of like a frayed piece of rope. You put stitches in the rope and tack it back down to the bone. So that's an ACL repair. They're not as common, but it's something that's possible as well. So just kind of keep in mind if someone says they had their ACL reconstructed versus repaired, reconstruction is the most common way at this time. And so here are some pictures. The bottom schematic is showing a hamstring graft. So there's different types of grafts that we can use to make a new ACL. So there's the patient's own tissue, which is called the autograft. And there you could use the hamstring, you could use the patellar tendon. Those are probably the two most common. You could also use the quad tendon. Depends on the patient's activity level, their sport, surgeon preference. There's a lot of factors that go into determining what graft you're going to use. So in this picture, it's the hamstring graft. So it shows the hamstring tendons that we take and how you fold them over and turn them into a graft that you put for a new ACL. In this top center picture, I'm holding an ACL graft. Basically, that's called allograft, is when you use cadaver tissue. So someone else's tissue that is treated in the lab to make sure that there's no cells, no disease or anything. And then that could be placed into the patient. Now for this picture, I'm holding it, I have sterile gloves, but I'm not gowned. This was actually for a lab. So that wasn't one that was used in a patient, but you could see how long it is. And we fold it in half, and that folded half goes up into the bone. And the x-ray on the side, it's a little tough to see, but there's the tibia has a little tunnel and then the femur has a tunnel, and it kind of just shows the x-ray of what an ACL looks like after surgery. So a tunnel through the tibia and then up through the femur, and that's how we reconstruct the ACL. And of course, the rehab is going to be varied depending on surgeon preference, the graft type that was used, and then also the sport that the patient is returning to. So you may have heard of like pro athletes get their ACL and they're back out there 6 months. You got to take that with some caution and think that they have all the top of the line rehab equipment dedicated to them and at their disposal, versus someone that's in high school and maybe like football or soccer. So it could take 9 months to a year before they get back to their sport. Sometimes they'll wear a knee brace afterwards. Every surgeon has their own technique and rehab protocol, but ACL reconstruction is a very common surgery in sports medicine. Case number 3, 38-year-old male presents to clinic 2 months after being stung by a stingray while surfing. Reports that the sting was like a very bad bee sting, but 24 hours later, he was soaking in hot water. So 24 hours later, the pain and the swelling resolved. However, it's been 2 months and the location of the sting has not fully healed. There's like this pinpoint opening and it's draining clear fluid daily. So pretty much it reports like he puts his sock on and he walks around throughout the day and he notes he's got like this clear fluid that stains his sock and shoe. He denies any pain, swelling, redness to the area, able to walk, run, exercise, just this little pinpoint opening and clear fluid draining out of it constantly. It's been a few months. No fevers, chills, flu-like symptoms. Remember, you want to always kind of assess the patient as a whole, because situations like this, you worry about infection. So anytime there's some kind of like foreign body or entry of something, you want to make sure there's no systemic illness or infection that could be causing symptoms as well. So on exam, there's a 1 centimeter round open wound in the lateral aspect of the heel with active serous drainage. So serous is kind of like that yellow clear fluid. If you ever had a scab or a cut and it's kind of healing and it oozes this little clear yellowish fluid, that's that type of fluid. It's not pus, it's not an infection, but it's just this fluid usually related to skin healing or wound healing. It's tender to palpation over the area, but there's no surrounding erythema, which is redness, and no other signs of infection. You get an x-ray and you don't see anything on the x-ray. You get an MRI scan and it's hard to tell, but within that red circle, there's like a little white horizontal blob in the middle of the black. So the black on the outside is the skin, but there's like this white opening. And on MRI, the radiologist knows that's a foreign body at the sting site. So the radiologist confirms that there's a stingray barb found just below the skin on MRI scan. So the treatment plan is incision and drainage of the wound, which was performed on their local and clinic. So a little lidocaine surrounding the area to numb it up, a scalpel to basically make a small incision and take out the damaged tissue surrounding the barb. And the barb, in this particular case, it was just a small little area, and the wound was allowed to heal with time. No stitches were placed in hopes to let the wound heal and make sure that there's no barb that was left over. There's like a little crater taken out of the skin, and it was allowed to heal on its own through with time. And the skin heals from the bottom up. So if there was any other foreign body, it would basically kind of get itself pushed out with the skin healing. So after 3 weeks of after that procedure, the wound was completely healed. It had scab, which was fallen off, and then it was scarred over. There's no residual pain, drainage, swelling, no redness. Everything pretty much returned back to normal. Able to run, participate in all activities without pain or issues. And here's a picture of a local stingray in the Huntington Beach area. And then just a little handout that shows like what to do when you get stung by a stingray. Now, my favorite part about case number 3 is that's actually me. So this happened to me about 6 months ago. I was surfing in Huntington. I stepped on a stingray. Pain, swelling. I've been stung by stingrays in the past. Usually I just soak it in hot water and it goes away and I'm fine. But this time it lingered. And being the typical clinician that I am, I just pushed it off and I was like, you know what, it's going to heal eventually. And it never healed. And so I got an MRI, which showed a barb, so a foreign body in there. And one of the orthopedic surgeons in the office was kind enough to excise it out for me, and now it's all healed up. So sometimes you get to be the patient yourself. So just kind of keep that in mind. When you're a clinician and you're working in the medical field, don't be too stubborn. If something's going on with your body and it's taking too long to heal, don't just write it off and say it'll get better. Actually get it taken care of and looked at. So that was my fun case to share. Some of the exciting things I've been able to do as a physician assistant working for as long as I've had is I like to help the future of the PA profession. And as the PA profession is growing in popularity and more people are interested in the profession, I started up Your Journey to PA School, which is just kind of, we have a Facebook group and just kind of like an organization where we help people interested in becoming PAs. So we've hosted events. The picture in the center is a group photo from a conference that we used to have when we had in-person meetings and events. And then the one at the bottom where we're holding a flag, we're setting up doing meetups where we'd go meet at like a public restaurant area and just hang out and everyone could network and learn about the PA profession and bounce ideas off of PAs. We would have PAs, PA students and aspiring PAs. It's just a nice place where everyone has a chance and opportunity to connect and network and learn about the profession. And one of the things I really am passionate about is in terms of the PA profession, there's only so many things you can do to kind of help the profession. And I thought, you know what, one thing I really want to do to help the future of the profession is make sure that people that become PAs in the future are as passionate and motivated to be successful PAs as I was back when I was starting in PA school. So that's kind of the ultimate goal, is I want to make sure that the future of the profession is strong, vibrant, and bright by helping to cultivate those interested in becoming PAs. So those are some of the hobbies that I've done on the side now that I've been practicing it for a PA for as long as I have. If you're interested in connecting with me, I have my Instagram, AnthonyG_SportsMedPAC. I have a YouTube, Anthony Gauthier, PAC ATC. And then we have a Facebook page. If you're in SoCal, we have SoCal Pre-PA Facebook page where we're doing meetups every couple months. So we haven't, of course, with COVID, but the goal is hopefully soon, next few months, we start doing meetup events again and conferences and just fun things to promote the profession. So I want to thank you all for allowing me to present to you all today. And I look forward to any questions that you have about being a PA, my journey to PA school, practicing in sports medicine. So feel free to ask any question that you like.
Well, there we have it, everybody. Uh, there was another wonderful presentation that we learned from. So we are going to now start with our live Q&A session. Please feel free to raise your hand and ask it out loud if you would like. And now we are going to begin. So the first question that we received was from John V. And she wanted to ask, do you have any questions, any tips for shadowing and networking during this COVID situation?
Oh, that's a question I get asked all the time. I know how difficult it is for people to shadow in this time, and I think it's awesome that events like this are being hosted. I would allow students to shadow me all the time in clinic, but with COVID, we stopped that. Most of the clinics are not allowing outside individuals to enter or to shadow. I would say instead of kind of becoming distraught about not being able to find PAs or people to shadow, I would use this time to kind of focus and develop some connections and relationships with PAs in terms of asking them questions, so that when the time does permit to have shadowing again and volunteer opportunities, you're already in their mind. So if you send some emails back and forth, kind of developing a relationship in terms of them knowing who you are and having like a name recognition. So once things open back up, you could send them a quick email and just update them and ask if they're allowed to shadow. And the likelihood is going to be higher because you kind of already developed a rapport with that person. So when they're allowed to, they'll be more willing. In terms of networking, social media is just number one. I know people that use LinkedIn as a more professional way to connect with PAs, social media and Instagram and Facebook. In terms of my recommendations and tips for those of you that are interested in connecting with PAs or any healthcare professional via like social media, especially Instagram, I get this a lot, where people are just very casual and laid back in terms of, hey, I like your Instagram, I like your posts, can I shadow you? And you're like, sorry, not gonna happen. Just think, having someone shadow me is, and you do it through that way, it's like inviting a stranger to come hang out with you all day at work. It's not something you're really excited to do. But if you have this rapport with someone and you know, okay, this person's a college student at the local university, they're part of the PA club, they've done this volunteer activity, they are friends with this other PA I know who referred them and recommended them, then when they drop me an email asking to shadow, I'm more inclined to allow them to shadow. So I would just be very professional in the way you interact with any of the PAs, especially if you're doing like cold emails. I'm not a big fan of cold calling offices. I know there are people that say they have been successful cold calling offices and hospitals asking to speak to the PA to shadow. I'm not a big fan of that. That's just me. I'm too busy throughout the day to kind of stop and listen and take time to talk on the phone about it or like call you back. It's just something not high on my priority list. So I'd recommend just trying to make the connections now, asking questions of, what's something you enjoy most about the PA profession? What are your thoughts on PA name change? Things like that. That kind of are the icebreakers. So that way, once you built that rapport, you could later on ask to shadow. One of my favorite analogies is if you're walking down the street, I usually say on campus, but most everyone's doing Zoom school now. So you're walking on campus and some random person asks to borrow $10, you're going to just be like, sorry, and keep walking. But if you're walking on campus and your friend from the club, like PA club or whatnot, asks to borrow $10, you're more likely to do it. Why? Because you know them. So the same holds true when you're asking someone to help you out or to shadow. So keep that in mind.
Thank you so much. I think that's really good advice moving forward, especially since it is hard to know how to connect with professionals now, but just having that perspective on what is appropriate and how to communicate is always key. So one question we did have was from Johanna, and they asked, have you ever dealt with patients not understanding and and how do you go about explaining it to them and maybe like validating your position in healthcare?
Right. So back when I first started as a PA in 2008, pretty much every single person I encountered assumed I was a med student, and I'd have to explain I'm a physician assistant, I've completed my training, I'm a healthcare professional. And I had kind of this whole spiel, that like a 30-second spiel I would give every patient to help them understand what a PA is in my role at the clinic. One of the interesting things and things I'm excited about is the profession has improved and gained so much notoriety in the general public, and more people are aware about the profession, that now when I go into rooms and introduce myself as a PA, I'd say 9 times out of 10, they're like, oh, my neighbor's a PA, or my granddaughter wants to be a PA, or my friend is a PA, which makes life a lot easier because there's this understanding by the general public of what a PA is and what the role is. Now, granted, not everyone is in that situation, and I'm still explaining, but the main thing is a lot of times, and of course now I look older, when I was first starting out, I looked like I was still in high school. And so the patients are like, what, you're gonna help me take care of me? I guess with some of the age comes wisdom with that as well. But the thing is, you don't want to try to sound like you're better than anyone else. Like a PA can do this, this, and this. You need to just kind of be more personable in the aspect of understanding what a PA is, telling it to them. And I've had plenty of patients that are like, I don't want to see you, you're a PA, I want to see the doctor only. And you have to respect their wishes. I can't try to force people to be seen by someone they don't want to be seen. I usually don't just write it off and be like, see you later, and move on. I usually try to educate them of what a PA is. And I would say majority of the time, if someone says, I don't want to see a PA nowadays, it's because they had an experience in the past with the PA that, you know, didn't bode well. Maybe something happened and they just didn't have a good experience with a PA. That seems to be the case nowadays. So, you know, of course, if someone's not interested in being seen by me, I respect that, but I try to educate them of what a PA is and their role of medicine. And vast majority of people nowadays, like I said, are aware at least what a PA is.
Well, it appears that not only do we have a PA in the house, but potentially an author, because an audience member, Moses, just asked the question, are you the author of Your Journey to PA School? Can you highlight some advice that you give in the book?
Yeah, so I have a lot of things I have out on like social media and like ebook. Basically, so many people are emailing me questions, and I realized, hey, I'm answering the same like question in this email. And so I would keep my answers and just like copy and paste when they would write, like, how do I find shadowing? How do I do this? And then I said, you know what? I have all these emails of like my answers for these questions I keep getting. Why don't I just try to organize it more in a book? And so I have an ebook on Amazon that you can check out. And it basically kind of goes through each step on like how to goal set for becoming a PA, how to connect with PAs in terms of shadowing. And of course, this was written before COVID, so some of those things aren't going to necessarily help in this point in time, but once everything opens back up, you know, finding ways to connect with PAs, understanding what type of healthcare experience could benefit you, leading towards a career in PA profession, understanding the importance of networking, things, more specifics to applying to PA school, like GRE, what things to look for in a PA program that you want to attend. A lot of people, when they're applying to PA school, they just like scan through and say, oh, I meet all the requirements, I'm going to send my application. But there's a handful of things to consider, like the cost of the program. Some programs are a lot more expensive than others, the geographic location of the program. One thing a lot of people aren't familiar with is that some of these PA programs, they might be associated with a major university, but their PA program in the facilities are like an annex building, not next to the campus or not on campus. So I know people that are interested in going to a school because of their campus, and lo and behold, the PA school's in like the next town over. Things like that are needed to be considered. Also, PA school, you're really going to gain experiences through clinical rotation. Make sure that schools you're applying to have good sound clinical rotations at major hospitals and clinics and availability, because unfortunately there's so many PA programs opening up now that some aren't able to have the clinical rotation sites. And so you might be limited on where you could go or what specialty you can rotate with. So those are some of the things that I highlight, which is really good if anyone's just like starting their journey, like maybe you're a couple years into applying, it'd be good to check out because it kind of walks you through all the steps and gives you an idea of what to look forward to as you're going through right before you apply.
Thank you so much. And that's exciting to know that we do have an offer here today. Dylan, if you would like to go ahead and ask your question.
Yeah, Anthony, I have a chance to work with current PAs right now as a dietitian, and a tough question I always love to ask them to get their perspective is, where does the job of a PA end and the job of like a DO or an MD kind of begin? You know, where is kind of that boundary where you would say like, hey, you know, I need someone, you know, with some more specialty?
Yeah, that's a great question. And really, the answer boils down to how much experience the person has. So as a new grad PA, I was asking questions like crazy. I was asking for help because there's always this second guessing of like, am I doing the right thing? Did I prescribe the right antibiotics for this situation? And so you're constantly just kind of second guessing yourself because you don't want to make a mistake. Like all of us in here are probably at some level of perfectionists because it seems to be a common characteristic trait for those interested in medicine. So you have to just understand you don't know what you don't know. So you just have to keep asking questions and learn from your peers and learn from those that have the experience. But as you gain more experience over the years, you get to a point where you become more comfortable and familiar with situations. So there'll be times where I'll encounter a patient and I'll be like, oh, I've seen this a million times, do X, Y, and Z. And then like the new grad PA is like, wow, I didn't even think about doing that. So where the fine line, there is no fine line. There's no like, okay, once you hit this, you got to go to the MD. It's mostly trust in your skills and ability and understanding when you're like, hey, I can't handle this. I need to get some more help. There are certain situations too in terms of like, of course, surgery, PAs cannot perform their own surgery that require general anesthesia. You can do procedures in the office, you can assist in surgery, but I can't do my own knee replacement. So those are things to also consider. A lot of times, just because of the patient-surgeon relationship, and it's really the surgeon's reputation online for surgery, there are like certain pre-op and certain things I just, you know, let my supervising physician handle because there's no point in me. I've kind of learned over the years, I could go in, see a patient, say all the things, and then they're like, I want to ask the doctor a question. And he comes in and they pretty much ask the exact same things. He answers it the exact same way. It's just, you know, the perception of being able to hear it from him gives them, you know, some peace of mind. And that's understandable. And so I've kind of learned over the years what questions you just allow them to handle, what things I feel comfortable with handling. But yeah, that's really good because you're going to come across people that have a lot of experience. They're PAs and nurse practitioners that have been practicing for like 25, 30 years. They're going to know more and have more skills than someone that just completed their residency. And so that's sometimes people kind of maybe get confused on if they're not familiar with the situation, like, oh, this person's a doctor, I want them to take care of me. But they might not have the experience yet because they just completed their residency versus someone that's been working in the field for 20 years. So that's an interesting thing to consider when working in medicine.
Thanks.
Thank you for asking that question, Dylan, and thank you for answering that question, Anthony. Well, a very popular question that appeared among the audience members is, how do you balance your personal life while working as a PA? Is it stressful being a PA? And if so, how do you manage your mental health and the stress that comes with the job?
Excellent question, especially with all this stuff going on right now. One of the kind of key highlights a lot of people are interested in PA profession for is because of the work-life balance. And I want to say that's not always true. So for those of you that are like, I want to become a PA because of work-life balance and lateral mobility, which are two like really key buzzwords a lot of people say when they're interested in PA school, like in theory, it sounds amazing, but it's not always the case. So I know plenty of people that are working their tail off, doing like ER, trauma, all this crazy stuff, working all the time, and they have no life outside of work. And then you kind of realize some people are just, that's their personality. Some people just love working, they're workaholics, or they have financial gains, like they want to make a certain amount of money. And so they're going to work hard and try to reach those goals. And that's all well and good. Me personally, I do want like the work-life balance. I'm married, I have 2 young children. I have a son that's 8 and a daughter that's 5. And I realized, you know what, they're at this age where I want to be able to hang out and spend as much time as possible. When they get older and they're teenagers and they don't care if I'm even around, like then I'll, I'll work more. But right now they're actually excited when I come home from work. They want to hang out. I want to read to them, be there to put them to bed. So really pride myself on taking the time now where I've been at my job for so long that I've kind of worked out my schedule where I do have a good work-life balance. Another thing to consider when you're working is being on call. Some people have to be on call where they physically go to the hospital or on the weekends and have to stay there the whole time, or they, in the middle of the night, if they get called at 3 in the morning, they have to go to the hospital, check it out. So those are some things to consider. In terms of mental health, some of the things I really enjoy, well, one, spending time with family, but exercise. If you follow me on Instagram, I run a lot. It's just something that's been like my mental stress relief. I just throw my headphones on, go run for a half hour or so, and I know at that time I could just not worry about anything. So exercise has been something that's really helped me out. And then also just like interacting with people like yourself, just being able to talk and interact. And it's so much fun to be able to do events like this or talk to people. And then a few years down the road, one of you are going to reach out to me and say, hey, I'm actually a PA now. And that blows my mind. For California Academy of PAs, we would have an annual conference. And previously I'd go and attend, and I'll be walking down the hallway and someone would come up to me and be like, hey, Anthony. And I'm like, do I know you? And they're like, I shadowed you this year. And then back then, and then I went to PA school here, and now I'm working as a PA over here, and stuff like that's really exciting. So those are the things that kind of keep me motivated and keep me focused and going.
Thank you so much. It's so inspiring to hear the success stories of other students. An interesting question I thought that we had was from Serena, who asked, do PAs also have medical scribes, or is that mainly in the emergency department?
So I do know PAs that have scribes. It depends on how busy the location is. So there's urgent, most commonly ERs and urgent cares, because they're going to be high volume. Like at the clinic I work out, I don't have a scribe because like our volume, even though we're busy, it's not like busy enough to hire a scribe or be able to have someone full time. But usually it's ERs and urgent cares or clinics that have high volume, because the scribe is great to help with the efficiency of the clinic. There's so many things to document that if you have someone that's able to document it for you while you're doing the exam, it saves a lot of time. And so that's mainly why you see them in the settings that you do. And any clinician could have a scribe. So PA, MD, DO, nurse practitioner, those are pretty much the ones that you may see having a scribe.
Yeah, for all the scribes out there in the audience, there is that useful piece of information. Several other audience members have asked about majors. And so Jacqueline and Stacy have asked, can a biology major be useful as well if you're considering sports medicine? And they also compared it to a kinesiology major. Is one recommended over the other?
So in terms of what major is the best for becoming a PA, there is no one major that's, quote unquote, the best. The vast majority of people are going to be bio majors. And the reason being is the prerequisite courses for becoming a PA are very science heavy. And so if you're a bio major, you're already going to knock out like the chemistries, OChem, anatomy, physio. So you're already going to kind of knock all those out as part of your majors. The vast majority of people are going to be bio majors. Now, if you want to do sports medicine or orthopedics, kinesiology, and I saw a question asking about athletic training, Like those do help you in that field, but I wouldn't choose it specifically unless you're already interested in it. Granted, pretty much every PA program, they want to graduate PAs that work in family practice or internal medicine. They don't necessarily want everyone to go into specialties like dermatology, orthopedics, things like that. So having the background helps you if your end goal is to work ortho or sports medicine, but you don't necessarily have to have it. Surprisingly enough, some PAs, you can have any bachelor's degree, as long as you have a bachelor's degree. It could be, liberal arts, it could be English, whatever, as long as you have the prereqs. And interestingly enough, some of the people that I know that have done really well in PA school were not even science majors. I had a friend that was actually a lawyer and then decided to become a PA, and she did really well. And I think part of that reason why is those of us that are science majors, we're just tuned to think in a certain structure, like everything's very like follow this algorithm and follow these steps. Step 1 will get you to step 2 and do this to get to step 3. We're very regimented in that way. But people that are in other majors that are like liberal arts or the arts, they're kind of thinking more like maybe abstract, or they just have a different viewpoint on things. And I think it kind of helps them in this setting. I'm not trying to make you guys convert to different majors, but it's just observation that I've noticed. So no matter what your major is, whatever you're passionate about, you can still eventually become a PA. It's just that science majors tend to knock out all the prereqs during their undergrad, so it just makes it easier. Actually, for me, doing athletic training at that time, like certain science courses, like certain chemistry courses, they weren't required as my major, so I'd have to take them during summer, or I'd have to take them in addition to my classes that were for my major. So it made it for a little more difficult semesters because of like trying to focus and do well here, but I want to also do well in my science and lab courses.
Thank you so much. We are nearing the end of our session today, so I'm sorry for all the questions in the chat that we aren't able to get to. But I think just to wrap it up today, we did have some just general questions as to like from Nicolette, what are tips you have for applying this cycle or any cycle, and just advice in general for everyone in the crowd today?
Yeah, just for anyone that's applying to PA school this cycle, understand the PA programs they know it was a difficult year. They know it was gonna have a hard time finding shadowing. Maybe you've lost hours because your position was furloughed, or maybe you were unable to find a position because of COVID. So they're gonna understand this. You don't need to focus your essay, your personal statement, or your application on kind of having like a sob story of, I was going to do all these amazing things this year and then COVID hit, so I couldn't do any of them. They don't want to hear that. They want to just see what you've done to kind of better yourself and prepare yourself for applying to become a PA. So I know so many people are writing their personal statement right now or brainstorming, and it usually starts out like, I was going to do X, Y, and Z, and then COVID hit, so I couldn't do anything. And you're like, that's not going to get you there. That's not the answer. You have to make sure you just kind of show the things you did do. And if it isn't sound as amazing as you had hoped, you just got to stay focused on the things that you did. Maybe you worked, at least got some hours, or maybe you went to events like this, or you networked with PAs and had coffee with the PA to pick their brain. Those things are going to show you're dedicated to the profession and interested in expanding your scope and learning more. So stay focused on that. In terms of just a general piece of advice for everyone out here, just remember, each and every one of you have your own unique journey. The biggest mistake that all of you are going to make, because I make this as well, is you're going to compare your journey to everyone else. You're going to go on social media, you're going to see so-and-so got accepted, so-and-so did this already, this person's doing this, and you're going to get upset, discouraged, frustrated because you haven't reached that step. Just focus on your own journey. One of my favorite analogies is you think of elite athletes, especially like swimming, running, that are kind of individual sports. What are they doing? Like the Olympics, you always see this during the Olympics. what are they doing right before the race? They're not looking around what everyone's doing. They're not trying to eye up the competition. They usually have their headphones on. They're staring at the ground. They have their eyes closed. They're just focused on their race, on their vision, and on their goal. And so if each and every one of you can just try to do that. I know it's hard. You're going to want to compare yourselves to others because I do that stuff all the time. But if you just try to stay focused on your journey and working towards your goals and not care about how long it takes or this person did this, it's going to work out so much better for you guys in the long run. So if each and every one of you could just stay focused on your journey, understand that it's going to be different than everyone else. And that's a good thing. We don't want everyone in medicine to be working that had the exact same journey and the exact same background. That's not going to help us with diversity in medicine. That's not going to help us increase access of care. All of you have something unique about you that's going to make you an excellent clinician in the future. So keep that in mind.
Thank you. I think that is some of my favorite advice I've ever heard in the closing remarks, and I can definitely see that people in the chat appreciate it as well. I think some people were asking if you did want to drop your social media or contact information in the chat. I know you did have it on your slides as well.
Yeah,
I think a lot of
I'll put my Instagram in the chat, and then if you guys say that you you're on this talk and you ask me a question, I'll get back to you. Just there's a lot of people on here, so be patient with me. But just say that you were in on this talk, and I'd be happy to help you out and do the best I can to help you out.
Thank you so much for coming in today. And yes, we had a huge audience, so definitely, and I think it was everyone who came, they definitely got their time's worth. So thank you again for joining us.
My pleasure. Thank you for having me.
Of course. So for all of my students here today, I'm going to go over our quick wrap up slides so you can get your post-shadow, so you can take your post-shadowing assessment and get your certificate for joining today. So some of the things we like to ask of you guys is just to kind of reflect. It can be in your head, it can be on paper, it can be typed out, it doesn't matter. But just think like what brought you to the session today? What are 3 major takeaways you got? And what do you want to learn more about? These things are, I think we were just talking about, personal statements, and thinking about these things and being able to reflect back on them it'll be a really great tool for you to use when you're back on or PA school or dental school or whatever professional school journey you decide to go on. If you do happen to type these thoughts out, we would love to hear about them. We'd love to see them. So you can go ahead and submit them at www.prehealthshadowing.com/blog submissions, and our team members will take a look at it and get you published on our website. If you are interested in being a part of pre-health shadowing and want to play a bigger role in our team, you're welcome to become either a volunteer or team member. Team members have some more responsibilities, and they lead efforts like grant writing and organization of projects and different outreach. Or you can still help us out and become a volunteer and do some asynchronous tasks on your own time. There's no minimum amount of hours you have to spend. So you're welcome to sign up and do that and indicate your interest on our volunteer form at prehealthshadowing.com. So once again, I'm going to humbly ask that if you can, you donate. It would be great. We are currently struggling a little bit to keep our website up and running with the amount of students that are now using it. It is amazing that we're able to provide all of this support to students around the world, but it does cost money, and we want to keep all of our services free. So if possible, please donate. If not, we completely understand, and we just ask that you spread the word about our program, and hopefully we can reach more and more students that need our help. So now for the moment we've all been waiting for, how to take your post-shadowing assessment and receive your certificate for attending the session today. So first thing you're going to do is go onto our website at prehealthshadowing.com, and you're going to find our professionals course page. It should be, if you just scroll down on the front page of our website, it'll be the first one under the most recent sessions. Then you are going to go ahead and take the quiz after you've clicked the free take this course. Make sure you have an account on our website. It's free. You just sign up using your email. Yes, there will be a recording. And so you can go on there and take the quiz to get the certificate for your virtual shadowing hours. Today, it is a simple 10-question multiple choice quiz based entirely on this presentation and the topics covered here today. Promise no surprise like terms or trick questions. It's all pretty straightforward. We just want to make sure you were paying attention and got out of it what you could have today. You just need to get a 7 out of 10 or 70% to get your verification. We offer you 2 tries. Each try is 30 minutes. We do try to account for technology errors, since we understand that our website does get overloaded sometimes, and that can cause problems on your end. Of course, you are free to email us at info@aclshadowing.com if you do run into any issues, and we will get it to you. Then you can just click finish this course and make sure to download your free certificate. So yes, this will be on YouTube. All of our past sessions going back to September are on YouTube for you guys to watch. And they're also on our website if you go to specific professional pages. This YouTube video in particular, we will try to get up by the end of the night. We do have to, upload it, edit it, and make sure it fits in and everything. So we will try to have it should be up by tomorrow at the latest. But you guys can go ahead and take the post-shadowing assessment. You can take it now. We do recommend that you wait a couple, like half an hour or so, just to let the volume of students on the website kind of slow down so that you don't run into any technical issues on the quiz. But of course, you can go back and take this quiz and any of our previous quizzes for previous sessions at any time. They're open indefinitely. So you can just literally sit there on your computer if you want all night and just binge watch a bunch of these episodes on YouTube and rack up all of those virtual shadowing hours. So that's what you can do this weekend, guys. Be sure to catch our sessions, which are going on every weekday through June, with a new professional each day. You can make sure to sign up to be on our email list and follow us on social media to get the regular updates. As I mentioned before, we are also looking to host some other events that aren't necessarily shadowing sessions. And for example, at the end of the month of March, we are going to have a all-female professional panel come in for the Women's History Month, and I will be there to host that. So I hope to see you guys there too. So thank you everybody so much for joining us today. And if you have any questions, you're more than welcome to stick around and unmute or drop it in the chat, and I'll be here with a couple of my team members to answer them. But yeah, otherwise this shadowing session is officially over, and you are all welcome to sign off for the day.